Sir, start na po ba?
Yes, kanina ko pa saan inaantay. Sige, you may now start. Sayang yung time natin.
A pleasant morning to each and everyone. So today we are the group 3 and we are going to present to you the health education. First, let me define health education. Next po. Okay. Generally, health education is defined as the principle by which individuals and groups of people learn to behave in a manner conducive to the promotion, maintenance, or restoration of health. So in other words, health education is concerned with promoting health. Promoting health means to provide information about health, to provide knowledge, and establishing changes also in personal and group attitudes and behavior. Changes in knowledge, feelings, and behaviors of people to promote healthier living. So, ang aim ng health education is to maintain norms of good health. So, the authorities should provide hygienic environment like good sanitation and all-around cleanliness. And to prevent also communicable diseases para ma-prevent po natin yung contamination or spread ng diseases. So, yun po ang general meaning ng health education. Next po. Ang health education, it is included in the curriculum of most schools. A comprehensive health education curriculum consists of planned learning experiences which will help students achieve desirable attitudes and practices related to critical health issues. So, health education helps to enable students to gain sufficient knowledge to provide desirable knowledge, all related to health problems. Okay, so health education provided knowledge regarding good health habits learning. So it helps to discover, to provide information to the students, lalo na kapag may mga injuries or may mga nadisgrasya. Etong health education nito is nakakatulong para magbigay po sa kanila, turuan po sila kung ano po yung mga gagawin nila during this kind of situation. So for instance, kapag kapag it helps to emphasize students on the bad effects of smoking and taking alcohol. So malalaman po nila, ma-educate po sila kung ano po yung mga bad effects ng alcohol at paninigarilyo. And through this, they will gain sufficient knowledge also, lalo na sa mga first aid or marriage, sex, and family planning, or etc. So, dun po siya. Some of these are emotional health and a positive self-image, appreciation, respect for, and care of the human body and its vital organs. Also, the physical fitness, health issues of alcohol, tobacco, drug use and abuse, health misconceptions, and quackery. So, we will be tackling that later on. Next po. Okay, so what is health according to WHO? When the In 1948, the WHO defined health as a state of complete physical, mental, and social well-being and not merely the absence of disease of infirmity. In 1986, the WHO made further clarification. So this means they said that it is a resource for everyday life, not the objective of living. Health is a positive concept emphasizing social and personal resources as well as physical capacities. So this means that the health is a resource para suportahan ang function ng bawat isa in a wider or in a whole society rather than sa pansarili lang nila. Okay? So a healthful lifestyle means to lead a full life with meaning and purpose. So when we talk about healthy living or healthy lifestyle, is nagpro-provide po siya ng full potential and meaning sa life mo. Ayun, so next po. Physical fitness, aspects of health. Physical fitness is good body health and is the result of regular exercise, proper diet and nutrition, and proper rest, physical recovery. A strong indicator of the health of localized population is their height weight, which generally increases with improved nutrition and healthcare. So itong mga regular exercise, balanced nutrition, and having enough sleep ay nakaka-contribute to para gumanda ang ating kalusugan, para pampalakas rin ng ating katawan. So dahil dito sa physical fitness or physical health, nababawasan ang risk natin sa mga diseases like arthritis, heart failures, and marami pang iba. So kaya nga po tayo nag-gym, nag-exercise, nagpapapawis para mabawasan yung timbang natin. Madalas nabe-base to kapag overweight ang isang tao. Syempre, nagda-diet siya, less rice, more fruits, tapos ano lang, nagiging vegetarian siya. Ganon. So therefore, nagiging nutritious ang mga tao. Gumaganda yung katawan nila in and out because they are physically fit. Kaya siya nabibase sa height and weight. Kapag underweight naman ng isang tao, syempre, masasabi mo na hindi siya kumakain ng tama, kukunti lang yung kinakain niya. So, hindi siya physically fit. So, yun naman po. Next po, sa mental health naman. Kung gaano po ka-importante yung physical health, ganoon rin po ka-importante ang mental health. When they say mental health kasi, it is our psychological or intellectual health. So, simply, sabi dito, mental health refers to an individual's emotional, psychological well-being. It says that it is a state of emotional and psychological well-being in which an individual is able to use his or her cognitive and emotional capabilities, function in society, and meet the ordinary demands of everyday life. So, yung intellectual health po, it depends on the perception of our experiences. Kung paano ka po mag-isip sa mga nangyari sa kapaligiran mo. Minsan, nade-depress tayo, meron tayong, nade-depress sila, meron silang anxiety attack at mental disorder dahil sa nangyayari sa buhay nila. Pero kapag meron kang good mental health, you will be able to enjoy life. You will be able to bounce back after difficult experiences. You will feel safe and secure. And ma-achieve mo yung full potential mo as a person. Kasi nga, maganda, good yung, healthy yung mental mo. Yung pag-isip mo. Ganon. So, next po, let's proceed to the determinants of health, presented by Aljon Isaac Lewis.
Determinants of health. The Lalonde report suggested that there are four general determinants of health, including human biology, environment, lifestyle, and healthcare services. The human biology includes the age, sex, inherited conditions, and genetic makeup of a human. The environment also includes the climate change, natural disaster, pollution, diseases, and global environmental issues. We also have the lifestyle, which includes the socioeconomic position, social roles, and circumstances of an individual. We also have the healthcare services, like mental health care, dental care, laboratory care, preventative care, nutritional support, and so much more. Thus, health is maintained and improved not only through the advancement and application of health science, but also through the efforts and intelligent lifestyle choices of the individual and society. A major environmental factor is water quality, especially for the health of infants and children in developing countries. How this water quality affects our health? Drinking poor water quality can negatively impact our overall health. It can cause major health conditions that can lead to serious illness. That's why it's important to drink good water quality to prevent disease, illness, and even death. Nutrition, also called nourishment or aliment, is the provision to cells and organism of the materials necessary in the form of food to support life. Nutrition is also about eating a healthy and balanced diet. Having a healthy diet throughout life promotes and supports normal growth, development, and aging, and helps to maintain a healthy body weight. It also reduces the risk of chronic disease, leading to overall health and well-being. The next presenter will be Mr. Jumari.
So, nutrients. Before we tackle the seven major categories of nutrients, let me first define nutrients. So, nutrients are substances that provide nourishment for essential for growth and maintenance of life. So, basically, these are chemical compounds in food that are used by the body to function properly and maintain health. Now, there are seven major classes or categories of nutrients. Major classes include carbohydrates, fats, fiber, minerals, protein, vitamins, and water. And these nutrient classes can be categorized as either macronutrients, which are needed in large amounts, or micronutrients for smaller quantities. Next, please. Now, belonging in micronutrients, we have carbohydrates, fats, fiber, proteins, and water. And for micronutrients, we have minerals and vitamins. Next, please. Now, in macronutrients, excluding fiber and water, provide energy which is measured in joules or kilocalories. Vitamins and minerals, fiber and water do not provide energy, but are necessary for regulation of important body processes. So the explanation to this is fiber and water are technically not digested or absorbed by the body, but when in taking it, they do play a role in the important body processes. Next, please. So in the molecules of carbohydrates, these range from simple monosaccharides, which include glucose, fructose, galactose, to complex polysaccharides such as starch. Now, fats are triglycerides made up of various fatty acid monomers that are bound to glycerol. Now, glycerol is a simple polyol compound. It is a colorless, odorless, viscous liquid that is sweet tasting and non-toxic. Now, protein molecules contain nitrogen atoms in addition to the elements of carbohydrates and fats. And the nitrogen containing monomers of protein are called amino acids. Now, these amino acids, they fulfill roles such as energy metabolism. Now we proceed to minerals. Dietary minerals are the chemical elements required by living organisms. Are in the four elements carbon, hydrogen, nitrogen, and oxygen that are present in common organic molecules. A term mineral is archaic since the intent is to describe simply the less common elements in the diet. Heavier than the four just mentioned, including several metals and often occurring as ion nitrogen and oxygen in the body. Next, please. Now, macrominerals. Macrominerals have a similar meaning to macronutrients, but macrominerals are any minerals required in a diet in relatively large amounts. Many elements are essential in quantity that are also called bulk materials, are structural and play main roles such as electrolytes. Examples of macrominerals are calcium, which is a common electrolyte, chlorine as chloride ions, magnesium, phosphorus, potassium, also a very common electrolyte, sodium, and sulfur. Next, please. Now we proceed to vitamins, which will be presented by Kirill Marcos.
So, aside from the minerals and macrominerals, vitamins are also essential to our body, wherein vitamins are the substances that our bodies need to develop and grow normally. So, where do we get these vitamins? Basically, the main source of the vitamins needed of our body ay nanggagaling sa mga pagkain na kinakain natin. A good example of these are the fruits and vegetables, gaya ng orange, wherein this fruit is rich with vitamin C, and this squash that is high with vitamin A, B, B6, and C. As the minerals discussed above, the calcium, chlorine, magnesium, phosphorus, potassium, sodium, and sulfur. These There are also 12 vitamins that are recognized as nutrients necessary in the diet for good health. These are the vitamins A, C, D, E, and K, as well as the B vitamins like B1, B2, B3, B5, B6, and the B12. Though vitamin D is the exception. It can alternatively be synthesized or in the skin in the presence of UVB radiation. Meanwhile, there are also certain vitamin compounds that are recommended in the diet, such as the carnitine, where these are indispensable for survival and health. But these are not strictly essential because the human body has some capacity to produce of different them from other compounds. Gaya ng sinabi kanina sa definition ng vitamins that these are the substances that our bodies need to develop and grow normally. Next slide po. So, the French paradox. It has been discovered that people living in France live longer. Even though they consume more saturated fats than Americans, the rate of heart disease is lower in France than in North America. So, some reasons why do French people tend to live longer than anyone else are because they are more active when it comes to their lifestyle. Like for instance, kapag may pinupuntahan sila, they tend to prefer walking rather than to use vehicles. Hindi gaya sa atin or sa iba na kahit malapit lang ay kinakailangan pa nating sumakay. Another reason is their wine consumption. Aside from France being known for their delicious wines, they are also recognized for having wine as one of their factors to their healthy living, as they believe that wine can lessen the risk of heart diseases. But even though it can bring health benefits to them, they are still drinking it responsibly. Next slide po. So, exercise. Exercise is the performance of movements in order to develop or maintain physical fitness and overall health. It is often directed toward also honing athletic ability or skill. Frequent and regular physical exercise is an important component to prevention of some diseases of affluence such as cancer, heart diseases, cardiovascular diseases, type 2 diabetes, obesity, and back pain. I will not further explain it anymore po as this is a self-explanatory topic. Next slide po. So, exercise are generally grouped into three types depending on the overall effect they have on the human body. These are the flexibility, aerobic, and the anaerobic exercise. So, when we say flexibility exercises, these are the exercises such as stretching that improves the motion of muscles and joints like yoga, tai chi, etc. Next is the aerobic exercises. Ito naman yung type ng exercise that focuses in the increasing of the cardiovascular endurance and muscle density. And lastly, anaerobic exercises such as weight training or sprinting can increase the muscle mass and strength. Physical exercise is considered important for maintaining physical fitness, including healthy weight, building and maintaining healthy bones, muscles, and joints, promoting physiological well-being, reducing surgical risks, and strengthening the immune system. So, generally, physical exercise plays a vital role in our lives as this gives so many health benefits for us humans. Next slide po. Hygiene, top of form. Hygiene is the practice of keeping the body clean to prevent infection and illness and the avoidance of contact with infectious agents such as yung paghugas natin ng kamay, pagligo, pagtoothbrush at kasali na rin dun yung mga skincare routine na ginagawa natin. So, I think is everyone aware naman what does hygiene mean? So, I will not explain it furthermore na po. So, now let us proceed to the next presenter, which is Miss Erani Magtagan.
Stress management. Prolonged psychological stress may negatively impact health, such as by weakening the immune system. Stress management is application of method to either reduce stress or increase tolerance to stress. Stress can be effectively managed in many different ways. The best management plans is usually includes the mix of stress relievers that address stress physically and psychologically and help to develop resilience to coping skills. Way to manage stress. Number one, rebalance to work and home. Number two, build in regular stress. Number three, eat well and limit alcohol and stimulants. Number four, connect with the supportive people. Number five, crave out hobby time. Number five, sleep enough. And number six, build bond with your pets. Next po. Healthcare is a health. Healthcare is a prevention, treatment, and manage of illness and the prevention of mental and physical well-being through the service offered by the medical nursing and allied health profession. Health can Health is a state of complete physical and mental and social well-being, and not merely the absence of diseases or firmly. Health is a positive concept in emphasizing social and personal resources as well as physical capacities. This means the health is the resources to support an individual function in a wider society rather than itself. A helpful lifestyle provides and its means to lead as a full time with meaning and purpose. Next po. Workplace Wellness Program. Work, Workplace wellness programs are recognized by the increasingly large number of companies of their value in improving the health and well-being of their employees and for increasing morally and loyalty and productivity. Workplace wellness program aims to reduce employees' stress and create a work improvement that lead to, to flourishing for both the employee and the employer. Companies that offer wellness program can cultivate and manage a management among workers. It can also reduce sick days and absenteeism and increase performance and productivity. Essentially, workplace well-being program provides employees with the insensitive tools, supports, and strategies to build a healthy lifestyle. Next po. Public health. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized effort and informed choices of society, organization, public and private, communities, and individuals. It is concerned with threats to the over, overall health of a community based on the population health analysis. The focus of public health intervention is to prevent rather than treat a disease through surveillance of causes and the promoting of health behavior. In addition, it, to this activity in may causes treating disease can be vital to preventing in the others, such as during outbreak of an infectious disease. Vaccination program are distribution and distribution of condoms are example of public measure. Next po. The next presenter will be Ate Hana Angela Mariano po.
Health science is the branch of science focused on health, and it includes many subdisciplines. There are two approaches to health science: the study and research of the human body and health related issues to understand how humans and animals function, and the application of that knowledge to improve health and to prevent and cure diseases. Some examples of subdisciplines under the health science is anatomy, pharmacy, radiography, and many more. Now, moving to the two approaches of health science, the study and research of the human body and health-related issues simply means that in health science, they would study how human bodies and also animal bodies function and operate in some circumstances and cases. This is to understand how their body works in some situations. And once this knowledge is acquired, the application of this knowledge comes in, wherein the knowledge acquired is used to improve health and to prevent and cure diseases.
Infectious or communicable diseases. An infectious disease is a clinically evident disease resulting from the presence of pathogenic microbial agents, including pathogenic viruses, pathogenic bacteria, fungi, protozoa, multicellular parasites, and aberrant protein known as the prions. So when we say pathogens, these are the bacterium, virus, or yung mga microorganisms that causes diseases. Transmission of an infectious disease may occur through one or more diverse pathways including physical contact with infected individuals, yung mga saliva, ganun. These infecting agents may also be transmitted through liquids, food, body fluids, contaminated objects, airborne inhalation, or through vector-borne spread. And when we say vector-borne spread, the disease is spread through mosquitoes, ticks, or fleas. There are also some other causes of diseases like toxins, genetic disorders wherein we inherit the disease from an ancestor or parent, and another one cause is the host own immune system. So it is possible for the host own immune system to generate its own diseases. Take note of that. So next page po. Some of the most common communicable diseases affecting many people are the following. A. Cholera is a bacterial disease that affects the intestinal tract. It is caused by a germ called Vibrio cholerae. So who gets cholera and how is the germ spread? Some symptoms of cholera are diarrhea, vomiting, thirst, and leg cramps. And those who are most likely to get cholera or be infected by it is those people who are traveling to foreign countries where outbreaks are occurring and people who consume raw or undercooked seafood from warm coastal waters subject to sewage contamination. In both instances, the risk is small. The cholera germ is spread by eating or drinking food or water contaminated by the fecal waste in countries of an infected person. But when we say fecal waste, this is a solid bodily waste. For example, yung mga poop and other waste like urine. The cholera occurs more often in underdeveloped countries lacking adequate water supplies and proper sewage disposal. Next po. Now let's proceed. What are the symptoms of cholera? By Jessamine Mamawag.
So, good morning po. What are the symptoms of cholera? So, what is cholera first? Cholera is an acute diarrheal illness caused by infection of the intestine with Vibrio cholerae bacteria. So, people can get sick when they swallow food or water contaminated with cholera bacteria. The infection is often mild or without symptoms, but can sometimes be severe and life-threatening. So, what are the symptoms of cholera? Profuse watery diarrhea, sometimes described as rice water stools, vomiting, thirst, leg cramps, and restlessness or irritability. How do symptoms appear? Symptoms of cholera can begin as soon as a few hours or as long as 5 days after infection. Often symptoms are mild, but sometimes they are very serious, which can lead into death if untreated. What is the treatment of cholera? Oral or intravenous hydration is primary treatment for cholera. In conjunction with hydration, treatment with antibiotics is recommended for severely ill patients. We can protect ourselves and our family by using only water that has been boiled, water that has been chemically disinfected, or bottled water. Be, u- be sure to use boiled or chemically disinfected for the following purposes: by drinking, prepare, preparing food or drinks, making ice, brushing your teeth, washing your face and hands, washing dishes and utensils that you can use to eat or prepare food, and washing fruits and vegetables. Is there a vaccine for cholera? Yes, there is a vaccine for cholera, but the CDC and the World Health Organization, or what we call WHO, have specific guidelines for who should be given this vaccine. How can cholera be prevented? Measures for the prevention of cholera mostly consist of providing clean water and proper sanitation to populations who do not yet have access to basic services, as well as vaccination with oral cholera vaccines. Health education and good food hygiene are also essential. Who gets dengue fever? Dengue affect infants, young children, and adult. Lahat naman po tayo ay nagkakaroon ng sakit or what we call illness po. Pero yung dengue po wala pong pinipili. So, how is dengue fever spreads? Dengue fever spread through the bites of infected Aedes species of mosquitoes. What are the symptoms of dengue fever? The following are the symptoms of dengue fever with any of the following: nausea or vomiting, rash, aches and pains, especially eye pain, typically behind the eyes, muscle joint or bone pain. How soon do symptoms appear? Dengue fever usually occurs after an incubation period of 4 to 10 days after the bite of the infected mosquito. Does past infection with dengue virus make a person immune? No. You can get infected with dengue not once but twice or multiple times, with each subsequent infection being deadlier than the other ones before. So, kapag nakagat ka po ng dengue mosquito nung una po, maaari pa po tayong ma-affect ng dengue fever kahit ilang times po or multiple times. Pero po yung susunod na pong sakit ay mas deadlier na po kesa sa dati. What is the treatment of dengue fever? There is no specific medicine to treat dengue. Treat the symptoms of dengue and see your healthcare provider. What can be done to prevent the spread of dengue fever? Put all used cans and bottles into dustbins with cover. Change water for plants and at least once a week, leaving no water in the saucers underneath the flower pots. Cover tightly all water containers, wells, and water storage tanks. Keep all drains free from choke. Top all defective ground surfaces to prevent the accumulation of stagnant water. Wear long sleeve clothes and long trousers. Use insect repellent over the exposed parts of the body. Use mosquito screens or nets when the room is not conditioned. So, mape-prevent po natin ang dengue fever kung susundin lang po natin mga tawag na, yung mga kailangan gawin para hindi hindi mapasukan or hindi mag-lay ng egg yung mosquito kung saan pagsisimulan po nung dengue fever. So, kapag may nakita po tayong contaminated water or yung nakastock na po na tubig, pwede po natin siyang ibuhos kasi mamumuo po dun yung kiti-kiti, tsaka po yung kung meron man kayong stock na water, maaari po nating takpan na lang po to prevent dengue fever. Yung next slide po. So, our next presenter will be Mr. AJ Mendoza po.
So, influenza flu. First of all, influenza is a viral infection that attacks your respiratory system, like nose, throat, and lungs. So, the flu is contagious respiratory illness by influenza viruses. It can cause mild to severe illness and at times can lead to death. Some people, such as older people, young children, and people with certain health condition, are at high risk for serious flu complication, like yung mga people na may na yung immune system tsaka yung mga hindi na sila healthy, and then the best way naman na i-prevent yung illness is by getting a flu vaccination. Next. So, what are the symptoms of the flu? Mataas na lagnat, fever, headache, extreme tiredness, dry cough, sore throat, runny or stuffy nose, muscle ache, stomach symptoms such as nausea, vomiting, and diarrhea may occur in children but are rare in adults. Um, the flu may seem like a common cold with a runny nose, sneezing, and sore throat, but colds usually develop slowly, whereas the flu tends to come on suddenly. And although a cold can be better, you usually feel much worse with the flu. Next. Are some people at higher risk for complication than others from getting the flu? So some of the complications caused by flu include pneumonia, dehydration, and worsening of chronic medical conditions such as congestive heart failure, asthma, or diabetes. And then, of course, children may get sinus problems and are infections. So, how is the flu spread? The flu is spread in respiratory droplets released by coughing and sneezing. It usually spread from person to occasionally people may be infected by touching something with virus on it and then touching their mouth or nose. So, when and for how long is the person able to spread the flu? People with flu are contagious, able to infect others beginning one day before getting symptoms. Adults remain contagious up to 7 days after getting sick. And children can remain contagious for even longer. Next. The next is presented by Jenny Maglapay.
So, good morning po. So, cold versus flu. What is the difference between a cold and the flu? The flu and the common cold are both respiratory illnesses, but they are caused by different viruses. Because colds and flu share many symptoms, it can be difficult or even impossible to tell the difference between them based on symptoms alone. Influenza or the flu and the common cold can be tricky to tell apart. Both are respiratory illnesses caused by viruses and they share many symptoms. The common cold and the flu are both contagious, but cold symptoms tend to be milder and improve within a week to 10 days. While most people who get the flu recover in less than 2 weeks, the symptoms are more severe and serious complications, such as pneumonia, bronchitis, and sinus or ear infections. Next is what are the symptoms of the flu versus the symptoms of a cold. In general, the flu is worse than the common cold, and symptoms such as fever, body aches, extreme tiredness, and dry cough are more common and intense. Colds tend to develop gradually, while the flu tends to start very suddenly. Both the flu and colds affect the respiratory system, though flu symptoms are typically more severe than those of the common cold. Unlike a cold, the flu is usually accompanied by fever and influenza symptoms tend to come on more suddenly. Symptoms that the common cold and flu share may include body aches, headache, sore throat, cough, nasal congestion, and sneezing. Next po. What can I do to protect myself against the flu? The best protection you can afford yourself and others is to get vaccinated against the pandemic influenza. This will reduce the chances of you getting and transmitting the disease. However, the development of a pandemic vaccine takes time, during which the virus may already be circulating in the community, and even people who have been vaccinated can pass the virus on if they touch objects contaminated by an infected person. Sorry po. The single best way to prevent the flu is to get a flu vaccination each fall. There are two types of vaccines. The flu shot is an inactivated vaccine containing killed virus that is given with a needle. The flu shot is approved for use in people older than 6 months, including healthy people and people with chronic medical conditions. Next is the nasal spray flu vaccine is a vaccine sometimes called LAIV for live attenuated influenza vaccine, made with live weekend flu viruses that do not cause the flu. LAIV is approved for use in healthy people 2 years to 49 years of age who are not pregnant. So let's proceed to the next talk, which will be presented by John Verly Mabba.
Good morning po. So, who should get the flu vaccine? All persons, including school-age children who want to reduce the risk of becoming ill with influenza or of transmitting influenza to others, should get the flu vaccine. Those people at greatest risk for complications of the flu and those most likely to get or spread the flu should be vaccinated with the flu vaccine as soon as is it possible. Flu vaccination has important benefits. It can reduce flu illnesses, doctor visits, and miss work and school due to flu, as well as prevent flu-related hospitalizations and deaths. Next po. Who should not be vaccinated? People who have severe allergy to chicken eggs, people who had a severe reaction to an influenza vaccination in the past, people who had developed Guillain-Barré syndrome or GBS within 6 weeks of getting an influenza vaccine previously, children less than 6 months of age, people who are sick with a fever, These people can get vaccinated once their symptoms lessen. People with a mild illness can usually get the vaccine. Next. Can antiviral medications prevent the flu? For antiviral drugs like amantadine, rimantadine, oseltamivir, and zanamivir are licensed by the U.S. Food and Drug Administration or FDA for treatment and prevention of the flu. Antiviral drugs is not a substitute for influenza vaccination. All of all of these drugs are available only by prescription and are different in terms of who can take them, how they are given, dosages based on age or medical conditions, and side effects. Antiviral drugs are recommended for both treatment and prevention of flu. Antiviral drugs work best when taken within 48 hours of onset of flu symptoms, but they may still offer benefits when taken later. This medication may reduce the duration of flu by 1 to 2 days and prevent severe flu complications. Next.
Okay, so therefore, our health is very important in our life. We people should aim for overall well being, and it is the key to the good health. That would be all. Thank you for listening, and God bless us all.
Good morning, everyone. Good morning, sir. We are the Group 4 and we are about to present the continuation of our lesson, which is the health education. And with this juncture po, let me present also our group members. We have Ray Marvelo, Rancho Nina, Princess Kate, Pastor Shelly, Pagulayan Kyla, Pahela Zaidel, John Carl Ong, Oligario Donna, and of course yours truly, Tin Precepto. Our topic for today will be focused on what is malaria, what is all about pertussis, and what is all about tuberculosis. Next slide. Okay, so when we say malaria, it is a very serious and sometimes a fatal disease caused by a parasite. So, if ever na may magtatanong po sa akin, Tin, what exactly is malaria? Is it a virus or a bacteria or whatsoever? Well, the answer for that is hindi po. Hindi po siya bacteria or virus po. Next slide po. Okay. Dahil sabi dito, malaria is a mosquito-borne disease caused by any one of 4 different blood parasites cause plasmodium. And by the way, the 4 different blood parasites is first, we have Haemoproteus spp, second is Leukocytosin spp, and the third is Trypanosoma spp, and lastly, of course, the Plasmodium spp, which is the malaria and microfilaria. Saglit lang po, maingay po yung background ko. Sorry po. Nag-report na. Next slide po. Okay, next question is, who gets malaria? Okay, malaria is any person residing in or traveling to a country where malaria is prevalent is at risk for contracting the disease. Okay, so it is commonly infects certain types of mosquitoes, which is being feeds on human. Just like for example, guys, yung isang mosquito or a mosquito bite. If a mosquito takes a blood meal from you or from an infected human being, the mosquito is able to take in the plasmodium, in which is plasmodium is found in blood. So, although this malaria disease is very rare po, take note of this that anyone can get a malaria. Most cases kasi malaria disease is occur in a certain people who live in a country na which is malaria is present or it has a malaria transmission. So when a person or a group of people from countries with no malaria can become infected also, um, they will be infected when they travel to countries with malaria or through a blood transfusion. Okay, next slide po. How is malaria spread will be reported by Miss Oligario Donna.
What are the symptoms of malaria? Symptoms of malaria include fever and flu-like illness, including shaking, chills, headache, muscle aches, and tiredness. Nausea, vomiting, and diarrhea may also occur. Malaria may cause anemia and jaundice, yellow coloring of the skin, eyes because of the loss of red blood cells. If not promptly treated, the infection can become severe and may cause kidney failure, seizures, mental confusion, coma, and death.
How soon do symptoms occur? Symptoms of malaria can develop as quickly as 7 days after you're bitten by an infected mosquito. Typically, the time between being infected and when symptoms starts or incubation period is 7 to 18 days, depending on this specific parasite you're infected with. However, in some cases, it can take up to a year for symptoms to develop. The initial symptoms of malaria are flu-like and includes a high temperature of 38 degrees Celsius or above, feeling hot and shivery, headaches, vomiting, muscle pains, diarrhea, generally feeling unwell, and these symptoms are often mild and can sometimes be difficult to identify as malaria. With some types of with some types of malaria, the symptoms occur in 48-hour cycles. During these cycles, you feel cold at first when shivering. You then develop a high temperature accompanied by severe sweating and fatigue. These symptoms usually last between 6 and 12 hours. The most serious type of malaria is caused by the Plasmodium falciparum parasite. Without prompt tip, without prompt treatment, this type could lead to you quickly developing severe and life-threatening complications, such as breathing problems and organ failure. When and for how long is a person able to spread malaria? Mosquito transmission cycle. A person can only spread the disease if they have the parasite in their blood, but the disease cannot be spread directly from person to person. It can only be spread through the bite of an infected mosquito. The parasite may remain in the blood of an untreated person from 1 to 5 years, depending on which parasite is causing the disease. On other modes of transmission, because the parasites that cause malaria affect red blood cells, people can also catch malaria from exposure to infected blood, including from mother to unborn child, through blood transfusions, and by sharing needles used to inject drugs.
What is the treatment for malaria? Based in my research, the most common antimalarial drug includes chloroquine phosphate. Chloroquine, chloroquine phosphate is used to prevent or treat malaria caused by mosquito bites, and chloroquine is the preferred treatment for any parasite that is sensitive to the drug. In many parts of the world, parasites are already resistant to chloroquine and the drug is no longer an effective treatment. Artemisinin-based combination therapies or ACTs. ACT is a combination of two or more drugs that work against the malaria parasite in different ways. This is usually the preferred treatment for chloroquine-resistant malaria. Examples include artemether, lumefantrine, coartem, and artesunate mefloquine. Other common antimalarial drugs include atovaquone, proguanil, malorone, atovaquone proguanil sold under the brand name Malarone, among others, is a fixed-dose combination medication used to treat and prevent malaria, including chloroquine-resistant malaria. It contains atovaquone and proguanil. It is not recommended for severe or complicated malaria. It is taken by mouth. Primaquine phosphate. Primaquine is a medication used to treat and prevent malaria and to treat pneumocystis pneumonia. Spe- spe- Specifically, it is used for malaria due to Plasmodium vivax and Plasmodium ovale, along with other medication and other prevention if other option cannot be used. And let us always remember, it is very important to consult health professionals to determine the proper preventive drug therapy. The liberal and frequent use of mosquito repellents as well as using a bed net can be very effective in preventing mosquito bites. Next po. What is pertussis? Next. Pertussis, also known as whooping cough, it is a highly contagious respiratory disease. It is caused by the bacterium Bordetella pertussis. Pertussis is known for uncontrollable, violent coughing, which often makes it hard to breathe. Next presenter po.
Good morning, guys. Apparently po, sir, si Miss Pagulayan po, hindi po siya makaka-join today kasi po meron pong power interruption sa kanila. Bale, okay lang po ba na ano? Ako na lang
Sino
po
kukuha
yung
ng
magbabasa. Ako po.
Okay. Sige, go on.
Okay. Who gets pertussis? According to Ms. Pagulayan, it is mainly affects babies younger than 6 months old who aren't yet protected by immunizations. And also for the kids 11 to 18 years old whose immunity has started to fade. Whooping cough causes a severe coughing spells which can sometimes end in a whooping sound when the child breathes in. So, according to Ms. Pagulayan, ang pertussis daw ay maaaring mangyari sa anumang edad, ngunit pinakakaraniwang inuulat sa mga bata sa unang taon ng kanilang buhay po. Ang mga sanggol at maliliit na bata ay karaniwang nakakakuha ng sakit mula sa isang nakakatandang kapatid na lalaki o babae, or pwede rin yung isang may sapat na gulang na maaaring magkaroon ng banayad na sakit nito. Next slide po. Next one is, how is pertussis spread? So, pertussis bacteria are spread through droplets produced during coughing or sneezing. These droplets don't travel very far through the air and usually only infects persons nearby. Next presenter po.
What are the symptoms of pertussis? Pertussis begins as a mild upper respiratory infection. Initially, symptoms resemble those of a common cold, including sneezing, runny nose, low-grade fever, and a mild cough. Within 2 weeks, the cough becomes more severe and is characterized by episodes of numerous rapid coughs, followed by a crowing or high-pitched whoop. A thick, clear mucus may be discharged from the nose. These episodes may recur for 1 to 2 months and are more frequent at night. Older people or partially immunized children generally have milder symptoms. And pwede din tayo magkakaroon ng diarrhea early on. How soon after infection do symptoms appear? The incubation period is usually 7 to 10 days with a range of 4 to 21 days and rarely may be as long 42 days.
Is a person When and how long is a person able to spread pertussis? A person can only spread the disease if they have the parasite in their blood, but the disease cannot be spread directly from person to person. It can only be spread through the bite of an infected mosquito. The parasite may remain in the blood of an untreated person from 1 to 3 years, depending on which parasite is causing the disease, and direct person-to-person transmission does not occur in stored blood products but can remain infective for 16 days.
Next po.
What are the complications associated with pertussis? Major complications of pertussis are more common on infants and young children and may include pneumonia. This is an infection that inflames the ear sacs in one or both lungs. Second, middle ear infection or what they call otitis media. Loss of appetite means to have the same desire as you used to, yung hindi ka na palaging gutom at natatamad ka na kumain. Sleep disturbance like having insomnia or sleep paralysis. Syncope, a temporary loss of sleep. Dehydration, encephalopathy, a disorder of the brain, and lastly, apneic episodes, brief delay in breathing and death.
Next presenter po.
Next slide po. So, what is the treatment for pertussis? The treatment for pertussis is easily available and highly encouraged. It started early. It can help reduce the severity, duration, and the risk of complications, particularly in infants. So, once a diagnosis is made or suspected exposure has been determined, you should start on antibiotics immediately. So, there are three popular antibiotics that are used to treat pertussis. Is the azithromycin, clarithromycin, and erythromycin. Remember na, pero, pag 3 weeks or more ka ng may pertussis, hindi mo na need ang antibiotic. Kasi, kusa lang nag-i-improve yung symptoms. Ibig sabihin nun, nawawala na yung bacteria sa body mo. So, as I said earlier, that it is highly encouraged na magkaroon pa rin ng treatment. Kaya magpa-consult kayo ng doctor. Supportive care, such as plenty of rest and fluids, can ease symptoms. Kapag may pertussis ka or whooping cough, iwasan mo na ang mga irritants like smoke, chemical fumes, and dust kasi nag-trigger na yung cough mo. Next slide po. So, does past infection with pertussis make a person immune? The answer of that is no. Neither vaccination nor natural infection with pertussis guarantees lifelong protective immunity against pertussis. Since immunity decreases after 5 to 10 years from the last pertussis vaccine dose, older children, adolescents, and adults are at risk of becoming infected with pertussis and with vaccination. Hindi po permanent ang nag-give ng vaccine na protection against pertussis. Kaya wag po tayo natin. So next presenter.
What are the vaccine for pertussis? There are two types of pertussis vaccine. The first one is the diphtheria, tetanus, and pertussis vaccines, or what we call the DTaP vaccine. And the next one is the tetanus, diphtheria, and pertussis vaccine, or what we call Tdap. For the DTaP vaccine, it is used for 7 years old and below. For the Tdap vaccine, this vaccine is used for 7 and up pataas. Next please. Sorry. Tuberculosis. What is tuberculosis? Tuberculosis is a bacterial disease usually affecting the lungs, or what we call the pulmonary TB. The other parts of the body can also be affected, for example, lymph nodes, kidneys, bones, joints, and etc. etc. or what we call the extra pulmonary TB. Next po.
Have two questions here. Who gets tuberculosis and how is tuberculosis spread? Okay. Usually, guys, tuberculosis can... balik mo. Okay. Tuberculosis can affect anyone of any ages. Okay. For example, a person or a certain group of people with weakened immune system, sila talaga yung high at risk. Sila yung delikado if madapuan sila ng tuberculosis. And then next, we have how is tuberculosis spread? Okay. Tuberculosis can be spread through air. So how? If a person meron siyang sakit na TB, pwede siyang makahawa sa ibang tao or pwedeng yung TB is magsispread through coughs or sneezes. So if a person with an untreated pulmonary TB, coughs and sneezes, it may be pwede siyang makahawa sa ibang tao. So yun lang yan. Okay. Next presenter.
Persons with latent TB infection do not feel sick and do not have any symptoms. They are infected with M tuberculosis, but do not have TB disease. The only sign of TB infection is a positive reaction to the tuberculin skin test or the TB blood test. Tuberculosis is a disease caused by a germ called Mycobacterium tuberculosis that is spread from person to person through the air. TB usually affects the lungs, but it can also affect other parts of the body, such as the brain, the kidneys, or the spine. When a person with infectious TB coughs or sneezes, droplet nuclei containing tuberculosis are expelled into the thin air. If any person inhales air containing these droplet nuclei, he or she may become infected. So if two-person nasa labas and the other one is may infectious TB, then the other one is wala siyang precaution na mask or kung anong takip sa kanya, then kapag yung isa is nag-cough or nag-sneeze and the other one inhales that, ma-infect po siya ng infectious disease. TB, infectious TB. Next slide po. What are the symptoms of tuberculosis? The symptoms of TB include a low-grade fever, night sweat, weakness or tiredness, and weight loss. If TB is in the lungs, the person may also cough, they have chest pain, shortness of breath, or might be coughing up blood. Other symptoms depend on the part of of the body affected by the TB germs. Next po. Um,
How soon do symptoms appear? Latent TB. You have a TB infection, but the bacteria in your body are inactive and cause no symptoms. Latent TB, also called inactive TB or TB infection, isn't contagious. Latent TB can turn into active TB So treatment is important. So dito sa latent TB kahit na walang symptoms or whatsoever, kailangan pa rin ng continuous treatment para hindi maging active TB. So dito sa active TB, also called TB disease, this condition makes you sick and in most cases can spread to others. It can occur weeks or years after infection with the TB bacteria. Signs and symptoms of active TB include coughing for 3 or more weeks, coughing up blood or mucus, chest pain or pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, chills, and loss of appetite. Although your body can harbor the bacteria that causes tuberculosis, your immune system usually can prevent you from becoming sick. Tuberculosis can also affect other parts of your body, including the kidneys, spine, or brain. When TB occurs outside your lungs, signs and symptoms vary according to the organs involved. For example, tuberculosis of the spine might cause back pain, and tuberculosis in your kidney might cause blood in your urine. Next. When and for how long is a person able to spread tuberculosis? TB bacteria are spread through the air from one person to another. The TB bacteria are put into the air when a person with TB disease of the lungs or throat coughs, speaks, or sings. People nearby may breathe in this bacteria and become infected. Um, TB is not spread by shaking someone's hand, sharing food or drink, touching bed or toilet seats, sharing toothbrushes, or kissing. When a People with TB disease are most likely to spread it to people they spend time with every day. This includes family members, friends, and other coworkers or schoolmates. Next.
What is the treatment for tuberculosis? If you have an active tuberculosis disease, you will probably be treated with a combination of antibacterial medication for a period of 6 to 12 months. The most common treatment for active tuberculosis is isoniazid INH in combination with three other drugs, rifampin, pyrazinamide, and ethambutol. Next. What can be the effect of not being treated for tuberculosis? A person with tuberculosis can die if they do not get treated. Next presenter po.
MDR-TB.
Mi- Miss Kyla. Okay. Ako na lang. Okay. What is multi-drug resistant tuberculosis or MDR-TB? MDR-TB or multi-drug resistant tuberculosis. This refers to the ability of some strains of TB to grow and multiply even in the presence of certain drugs which would normally kill them. So according to Ms. Kyla Pagulayan, multi-drug resistant TB or MDR-TB is caused by an organism that is resistant to at least isoniazid and rifampin, the two most potent TB drugs. So these drugs are used to treat all the persons with TB disease. Okay, the treatment here is isoniazid. Okay, next presenter.
What is extensively drug-resistant tuberculosis or XDR-TB? Extensively drug-resistant TB is a subset of MDR15, which the strains of TB bacteria are resistant to several of the best second-line drugs for TB. It is a rare type of multi-drug resistant tuberculosis. Um, Drug-resistant TB is a serious clinical condition and remains a global public health concern.
Who gets MDR-TB? Babies and children under 5 years of age. They need to have treatment to prevent TB disease if exposed to someone with TB. Second, HIV infected person. Malnourished person. Those persons who are underweight and overweight. Persons living in overcrowded household, like prison and squatters area. Person whose immune system are not strong due to other diseases, like diabetes, mellitus cancer, and some medications. Lastly, person with substance abuse problem, like alcoholism, drug abuse, rugby addict, and etc. These are the people who are at greater risk of developing ordinary TB and also greater risk for MDR-TB.
Next presenter po.
What is the treatment for multi-drug resistant tuberculosis? For patients with disease due to drug-resistant organisms, expert consultation with a specialist in treating drug-resistant TB should be obtained. Patients with drug-resistant disease should be treated with drugs to which their organisms are susceptible. The effectiveness of treatment for latent infection with MDR-TB is uncertain. There are oral regimens that are prepared for almost all patients. Fluoroquinolones, defactinib, and linezolid are strongly recommended for a longer MDR-TB regimen. These three drugs should be included in the initial therapy unless there is an evidence of drug resistance or a risk of toxicity. Next presenter.
What can be done to prevent the spread of MDR-TB, or what we call the multi-drug resistant TB? Ensuring people with MDR-TB take all their medication and teaching patients to cover their mouth and nose when coughing and sneezing can reduce the risk of spread of MDR-TB. In addition, directly observed therapy should be used to ensure people with drug-resistant TB complete their treatment. Next one. That's all.
Okay, that is all, guys. Thank you for listening. Thank you, sir, for listening. Have a good day and God bless us all po.
Thank you so much, Group 4. Okay, so let's now proceed to Group 5.
So good morning each and everyone. Good morning, sir. So for now, we will continue the topic of the group 4, which is the health education. And please allow us to introduce to you the presenters. Ms. Ripari Prina, Rivera Audrey, Marian, Aran Rain, Jadel, Christine Joyce, the Angelica, Lovely Joy, and yours truly.
Good morning, everyone. What is HIV? HIV stands for Human Immune Deficiency Virus. Next. HIV, a virus that attacks the body immune system. The immune system protects the body from infection and disease but has no clear way to protect it. HIV is the virus that causes AIDS. People infected with HIV may have no symptoms for 10 years or more years. They may not know they are infected. Next slide. How HIV spread. HIV spread when infected blood, semen, vagina fluids, breast milk gets into the bloodstream of other person through direct enter into a blood vessels, molecules lining such as the vagina, rectum, penis, mouth, eyes, nose, or a break in the skin. Next. Methods of transmission of HIV: reusing and sharing needles or other equipment for injecting drugs, including steroids or hormones. Unprotected and unsafe vagina or anal sex, which means sex without using condoms or other barriers such as dental dams. Sex when an HIV negative partner or not taking pre-exposure prophylaxis as prevention. Sex when a partner living with HIV is not taking HIV drugs and or has a detectable viral load and none of the prevention tools above are used. Parental or mother to child during pregnancy, birth, or breastfeeding. HIV is also spread through contact with blood with body fluids. However, usually only healthcare workers come into contact with these fluids. Next. HIV is not spread through contact with these body fluids like sweat, tears, saliva, feces, or poop, urine. In other words, you cannot get HIV by touching or hugging someone who is living with HIV, kissing someone living with HIV, drinking or eating from the same cups or utensils as a person living HIV, or by using toilet also used by someone living with HIV. Next. Symptoms of HIV. Most people cannot tell that they have been exposed or have acquired HIV. Initial or acute symptoms of HIV infection may show up within 2 to 4 weeks of exposure to HIV and included fever, swollen blood, sore throat, night sweats, muscle aches, headaches, extreme tiredness, and rash. Next presenter, please.
HIV is very different from AIDS. If left untreated, HIV can lead to the disease called AIDS. AIDS is acquired immunodeficiency syndrome. Next slide. It is a late stage of HIV disease. It has no cure, but there are medications that have helped people living with HIV or AIDS to live longer and healthier lives. HIV infection is spread primarily through sexual practices or by sharing needles and other necessities. Next slide. There are five main viral classification of hepatitis. We have hepatitis A, B, C, D, and E. A different virus is responsible for each type of viral hepatitis. Our topic will only focus on hepatitis B, serum hepatitis. It is a liver disease caused by hepatitis B virus. Who gets hepatitis B? Anyone can get hepatitis B, but you are at greater risk if you have sex with someone infected with HPV virus, have multiple sex partners, have ever been diagnosed with a sexually transmitted disease, and are healthcare workers or public safety worker who has contact with human blood and are hemodialysis patient. How soon do symptoms appear? 6 weeks to 6 months after exposure, but usually within 4 months. Next slide, please. For how long is a people able to spread the virus? The virus can be found in blood and other body fluids several weeks before symptoms appear and generally persist for several months afterward. What is the treatment for hepatitis B? There are no special medicines or antibiotics that can be used to treat a person that is acutely infected once the symptoms appear. Generally, bed rest is all that is needed. Interferon is the most effective treatment for chronic HBV infection. You should avoid drinking alcohol or taking medications which are harmful to the liver. Some sources says that it can be treated by taking antiviral medications like lamivudine and etc. It can help fight the virus and slow its ability to damage your liver. Next slide po. What precautions should be hepatitis B carriers? Chronic hepatitis B carriers should follow standard hygienic practices to ensure that close contacts are not directly contaminated by his or her blood or other body fluids. Next slide po. These are the several human activities have led to the emergence and spread of new diseases. Encroachment on wildlife habitats, changes in agriculture, the destruction of rainforests, uncontrolled urbanization, modern transport, and lastly, pollution of the environment. Thank you. Next presenter po.
So how is the virus spread? First is pregnancy. So if the pregnant woman has an HIV or AIDS, therefore, it is possible for the mother to pass the infection to her infant during birth. This can happen during vaginal delivery or a C-section, and the baby may be exposed to the virus in the mother blood and other fluid. Second is the unsafe injections, needles, and transfusion of blood and organs transplant. This can be spread when the blood or fluid from an infected person enters the body of a person who is not infected. For example is blood donor or reusing of injections. Kung yung tao na yun is meron siyang HIV or AIDS tapos ginamit sa'yo, there's a tendency na mahawa ka or malipat sa'yo yung sakit. Last is unsafe sex. Hepatitis B can pass on via unprotected sex, including vaginal, anal, and oral sex, and other sexual activity with someone who has hepatitis B, even if there is no symptoms. For example, for example is yung partner mo, meron siyang hepatitis B, tapos nakipagtalik ka. So it is possible na mahawa ka at magkaroon ka ng hepatitis B or other STDs. Next slide po. Hepatitis B cannot spread through food, water, sharing eating utensils, toilet bowl, hugging, kissing, coughing, sneezing, or by casual contact. Hepatitis B is unlikely to be spread through saliva, but is possible through aberration of mouth sores that may occur as a result of rigorous kissing, bites, or trauma from dental appliances or braces when blood exchange may occur. Next slide. What are the symptoms of hepatitis B? So, meron siyang fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movement, joint pain, jaundice, or yellow color in the skin or eyes. Next. How can hepatitis B be prevented? Infection with hepatitis B virus can be prevented if you get hepatitis B vaccine or shot called HBIG or hepatitis B immune globulin as soon as possible. If makipagtalik ka naman, you can use condoms and dental dams to protect yourself from hepatitis B and other STD. Next presenter po.
The most common home accident and how to prevent it. It requires knowledge and a few easy actions to protect your family against typical mishaps in the house. Although it appears to be the safest place on the planet, the majority of accidents and injuries happen in and around the house. Unfortunately, most incidents might have been avoided with a few simple precautions. You might be amazed
On how many ways commonplace products can cause harm. Taking a close look around your home and life and removing obvious injury risks can go a long way toward safeguarding your family from a tragic accident. Common home accidents. Below
Below are some of the common accidents at home and simple measures to observe to prevent the effect of these common home accidents. Learn some simple things that instantly prevent common accidents in the house. First is drowning. It's the accident that often happens in baths such as swimming pools, seas, or waterfalls. How can we avoid it? First bullet. If you have small children, you should install locks on your toilet bowl lids and eliminate any standing water around the home. So, if we have a children or nephews, we need to take good care of them. All possible places with water where it is possible for drowning accidents, we need to keep them away. Second bullet. Be sure to keep any buckets or containers free from water and never leave your child unattended in the bathtub. Yun nga po, kailangan nating huwag iwan ang mga bata, lalo na't alam nating delikado ang tubig. Third bullet. Swimming pools should have fence built around them with lockable gates or have removable ladders. Swimming pools need to be fenced in and its gates locked so that children cannot get into it and they do not have accidents. Fourth bullet. If you have a baby pool in the yard, keep empty when you are not using it. You need to remove the water in the swimming pool after after we use it so that the children do not have some accidents like this drowning. Fifth bullet. Make sure your family is trained or knows CPR and take reviews on first aid from time to time. We need also the know to first aid in case it happens. Like use CPR na po na sinasabi. Kasi ito po yung madalas na kayo aksidente. So, next question po.
Another common injury around the home is burns. It is commonly caused by hot liquid or water, fire, electrical currents, chemicals such as strong acid, paint, thinner, or gasoline, and so on. So how can we avoid this kind of accident? First, never leave items cooking on the stove unattended and turn pot handles toward the rear of the stove. Second, keep hot liquid out of the reach of children and pets. Third, keep electrical appliances away from water and check the temperature of food before serving it to a child. Fourth, when using chemicals, always wear protective eyewear and clothing. Lastly, cover unused electrical outlets with safety cups. Keep electrical cords and wires out of the way so that children can't chew on them. Next slide po. Second, another common type of home accident is the electrocution. It is deadly or severe injury by electric shock or electric current that pass through the body. How can we avoid this? First, keep all electrical outlet covered with safety plugs so that children can insert metals item or put fingers on it. Second, keep plug-in cords hidden from view so that children or pets will not be tempted to chew on them. Third, place objects in front of outlet that have plugs in them. Fourth, in the bathroom, keep all appliances unplugged when hot is used and never keep an appliance near the bathtub. Lastly, exposed wire should be immediately discarded or taped with electrical tape. Next presenter po.
False. Fall prevention can save your family from bruising, broken bones, and even death. How can we avoid this? If you have little children, keep all top floor windows closed so that your children do not go there and to keep kids from falling out of windows. Put safety gates at the top and bottom of every flight of stair to prevent little ones from falling. Keep stairways uncluttered and especially keep the top stairways clear or anything that could be tripped over. Next slide po. Poisoning. Poisoning is a dangerous household accident that is totally preventable. How can we avoid this? Keep dangerous substances locked up in a secure location. Mouthwash, alcoholic beverages, and tobacco products are examples of common poison that should be kept out of the reach of children. Never induce vomiting unless you are instructed to do so by the Poison Control Center. Next presenter po.
So, choking. Choking is a hazard that mostly affects children. It has severe difficulty in breathing because of constricted or obstructed throat or a lack of air. So, how can we avoid this? Keep the floor clear of all small objects that could be swallowed, because sharp objects like glass or metal can injure the thin walls of the esophagus and cause bleeding or infection. Next is keep items that could have been small part chewed of them out of reach and never leave small children unsupervised. Third is throw away any plastic bags immediately to prevent suffocation, because suffocation is caused by the fact that plastics do not let through any air and breathing becomes impossible. Next, please. So, what is cut and instrument punctures? Cuts are open wounds made by any sharp instrument like a knife, a razor, broken made glass. They may bleed freely because the blood vessels are cut across, although only a little tissue around the cut is destroyed. Because of the bleeding, open wounds are not as likely be easily infected as other kinds. Sharp instruments usually caused by punctured woods and stubs, nails, and ends of wires carelessly placed on walls, floor, ground, or floor are common causes of punctures. Stubs and punctures do not bleed freely, hence they are hard to clean and become easily infected. So, how can we avoid this? First is don't walk barefooted in dirty places to avoid any sharp objects. Second is when your feet are unprotected, be sure to look out for broken glass or nails in order not to have a wound. Last is razor and knives should be properly handled. Hammering or applying excessive force or pressure to sharp and cutting tools can cause them to slip. Keep in mind that some materials or outdoor conditions can also make tools slippery. Stay aware and be vigilant when it comes to home safety. The most tragic accidents are the ones that could have been prevented. Next presenter po.
Good morning po. Home is the place where accidents are most likely to occur. So here are some helpful tips for staying safe in each main room of the home. First, in our family room. Next po. We should cover sharp furniture edges. Sharp or pointed objects can be hazardous and often cause injuries. In order to avoid accidents, it's good to put cover on sharp edges. Next, tape down rug edges. To secure you to secure your rug stays in place and it will keep you from slipping and tripping. Trips and stumbles can cause sprains and bruise. If you ever hurt your ankle or had another type of strain or sprain, it is recommended to do the RICE method: rest, ice, compression, and elevation as one of your first treatment. The RICE method is a simple self-care technique that helps to ease the pain and speed up healing. To prevent slips, we should put down a non-slip mat. To prevent slip and falls, place a rubber or non-slip mat on the floor and in the tub. Next, be safe with electrical devices. The bathroom is possibly the most dangerous room in the house when it comes to electrical safety. Make sure your electrical sockets are located a safe distance away from the shower. Cover the outlets when they aren't in use. And for the kitchen area, We should store knives. It is important to store your knives properly for safety reasons and to prevent damage and injury, especially po sa mga bata. Cut carefully. When you cut foods, make sure to cut it carefully to prevent wounds and scratch to your skin. If you drop a knife, let it fall. Don't reach for it and let it hit the floor. Next is empty the sink. Keeping your sink empty and dry will help cut down on bacteria buildup. Bacteria or germs are everywhere, including to your kitchen, where food is stored, and also to your utensils. It is important to take the necessary steps to clean your sink. Position hot pots. Make sure pot handles are turned inward when on the stove to avoid knocking them over. And lastly, store a fire extinguisher. You must have a fire extinguisher in your kitchen since it is the most likely room in your area for a fire to start. Typically, kitchen fires are grease fires and they cannot be put out with water. In fact, trying to put them out with water is very dangerous.
So the home first aid kit. So what is first aid kit and its purpose? A first aid kit is a bag or backpack that holds supplies used to treat minor injuries including cuts, scrapes, burns, bruises, and sprains. More elaborate first aid kits can also include survival supplies. So the purpose of this is to life-saving emergency supplies or convenience items like bug sting wipes or cold and flu medicines. So here are some examples of first aid kit at sure naman ako na alam itong mga bagay na to. So the first one is antibiotic treatment, which is to prevent infection kung may mga sugat man tayo na like namamaga ganun. Next one is the tweezers. It is used this to pull splinters or clean cuts and scrapes. Next one, the gauze and adhesive tapes. It's used this to dress larger cuts when other bandage won't do. Gauze also acts as a good compress to help stop bleeding. Next one, the elastic wraps. You'll need this for your sprains from twisted ankle and wrist. So the oral medicine syringes, these are the used to give children oral medications like cough syrup or antibiotics. You can also use this to flush and clean cuts and wounds. Next one, the thermometer. This one to para malaman natin kung mataas ba yung lagnat natin. The sharp scissors and rounded tips. This will help you to remove bandage or clothing from the skin without cutting or damaging skin. Further, hydrogen peroxide and antiseptic wipes. These are the both good for cleaning scrapes and cuts. Next one is the emergency number list. This should include to your doctor and local ambulance, fire department, and poison control center. It's also a good idea to have numbers for your pharmacy and a person who will act as your emergency contact. The last one is antibiotic ointment, and it also to prevent infection. Next presenter.
Treating injuries. Treating sprains and bruises is method is effective for relieving swelling and pain from the injuries. Treating cuts. Using a gauze cloth, apply steady pressure for around 15 minutes. Treating burns. Clean dish or hand clothes as well as a few cold compresses are required for a good burn first aid. Thank you for listening and God bless.
So, ayan, thank you. Always remember that health is maintained and improved not only through the advance and application of health science, but also through the efforts and intelligent lifestyle choices and the individual and society. Thank you, everyone, and stay productive and keep safe.